Hi there, welcome to the Healthtech Marketing Show, brought to you by Health Launchpad and HIMS. I'm Adam Chirinos, I'm the CEO of Health Launchpad and your host for today. And as ever, the Healthtech Marketing Show, we talk about all things marketing related to healthcare technology. And what we're always looking to do is to find ways to help the broad health tech marketing community learn new things, learn new skills, and share some insights and insights from our community. So the topic we're going to focus on today is something that we've never covered, and that's rural health. And it's an area where I think a lot of companies tend to stay away from rural health organizations when they're putting together their target market. They kind of immediately remove rural health care organizations from the target market. And so today I'm actually, we're going to talk to an organization that has taken another tack on that. And that's, I'm joined today by my great friend, Karsten Russell-Wood, who I've known for, we've known each other about 2 or 3 years now, right?
Minimally.
Yeah. And actually, you've been on the show once before, one of the early shows where we talked about trust, and it was really interesting perspective about brand building in healthcare. But just tell everybody a little bit about yourself and why rural health, just sort of popped into why it became an issue for you guys.
Yeah, so I appreciate it, Adam. And, I have to say, even starting off here, when you approached me about rural health, I think we both agree my answer was I'm a sophomore, right? I'm a student learning about this unique space. And 3 years into studying, now I marvel just about how rich rural healthcare is and the value of it. My background is primarily from the health technology standpoint across both GE and Philips, but now through Equum laser focused on the clinical workforce disadvantages that our health systems face.
Interesting. So, paint a picture of rural healthcare. The differences versus kind of like the main healthcare market that most companies are focused on.
I'll tell you a funny story. Let's make it very visual, right? Because sight is the most powerful sense.
Particularly in the podcast.
Right, for a podcast. So if you go to Shutterstock as a marketeer and you type in hospital and you type in urban hospital or rural hospital, the rural hospitals come with corn stakes and different large vast geographies, and immediately you look at it differently. And I think you rightly put it, many companies say, oh no, we want the tarmac rich urban hospital as our client, without really considering the power and the network of rural health across America. If we would look at the 6,000 hospitals, 58 some hospitals across the US, I'm going to quote the statistic, over 1,300 are critical access hospitals. That means hospitals with less than 25 beds. And many people would consider that a blip, but if you look at the power of rural America contributing to our nation's GDP, but also the community of Americans that live in rural markets. Approximately 45 million, that's 15% of the US population, lives in these rural communities. But that statistic talks about the population of the US. It doesn't talk about the providers in the US. And that's where we start seeing rural America being disadvantaged because the providers, especially specialists, don't live in those areas. And we're going through a period in America where, Americans are retiring and they're moving out of the urban areas to the rural areas. And so we are actually seeing where rural America is being more repopulated. Now, fast forward to access to care, which is really the biggest goal we all have. How will we, in a rural environment deliver care where distance is the biggest challenge. And this is really where digital health, marketing digital health comes in as a wonderful opportunity.
It's interesting when you paint it in terms of the statistics. It almost feels like what I actually picture is like rural health in terms of size of population is like a country the size of France or Germany. Yeah, or like, you know, California and another large state put together, you know, sort of like a big state and a medium-sized state two together. So big places, right? But
Oh, yeah.
in terms of actual number of providers, it sort of sounds to me like the sort of the ratio is probably more like a country in the developing world, in terms of the amount of providers per patient, as say relative to what it would be in a, you know, in a major metroplex, right?
You're spot on, and I think that's the challenge that we're facing. Is of course the higher end specialties are not located in the rural areas. In fact, less than 10% of the providers living in those areas. And what does that happen? Well, we generally will see a care out migration because across the US, and references have been given to what we call care deserts across large parts of rural America, where there just simply aren't the providers to sustain care. And so patients start driving further and further to receive care. And when that happens, we don't just increase the cost for care, but we actually can impact the sustainability of a community. And so not only is this an exercise of benevolence to try and uh, resource hospitals across the US, but it's actually a opportunity for companies that see value in their technology to apply it to these critical access hospitals. And
Mm-hmm.
I would actually look at these hospitals not based on my shutter stock analogy where we see, you know, the corn stalks, etc. But we have to look at the fact that for the longest time, many of the perceived disadvantages of rural health, which are geographical isolation, scarcity in resources, um, potentially those are in fact where digital health enables improvements in access to care. And rural America, through that, becomes a leader in digital health adoption.
That makes a lot of sense. And is that what you're experiencing? I mean, tell everybody a little bit about your business and what you guys do and where you fit into the digital health ecosystem.
Sure, sure, and I think that makes a lot of sense. So we're not coming at this from a technology standpoint, but of course we absolutely need technology to allow our services to work. Equum Medical is a acute care provider services company. So from admission to discharge, we support uh, high acuity care with pulmonologists, cardiologists, infectious disease docs, and high acuity hospitalist services. But then also, as we move through that continuum, we have virtual nursing, telemetry, and sitter. So ultimately, as we partner with telehealth companies, we're the provider people. We're bringing the resources that allow these hospitals not only to receive the audio video technology and the EMR systems, but also the workforce that can make that actually work.
That's very, very clear. And so, how would the experience be for a patient population? How would it have changed, sort of, kind of pre telehealth to the way it is now? It sounds to me like it's a better world, but you'd have a better sense of that.
Yeah, if we look at how telehealth is growing across rural America, um, there are many progressive grant programs through the government, through individual organizations to support telehealth. USDA is a great one that does grants
Really, the
for,
USDA,
yeah,
that makes perfect sense.
lots of wonderful
Yeah,
grants. So a lot of
yeah.
technology, right? Um, of course, there's always the balance of, are we moving into a population that accepts and adopts that technology, or are they going to be reluctant to use it? But what we've seen is health systems or hospitals, critical access hospitals, moreover, in these rural areas, what they really need is access to the specialists that otherwise have their community patients leave. And what happens in that outmigration is really, it's about community and it's about perception. Critical access hospitals are just like the bank and the post office. They're a cornerstone, a bedrock of
Mm.
a rural town. And so if the community isn't able to receive care there, they're leaving the town, driving multiple distances, and likely their follow-up care is going to be outside of that local hospital as well. So through telehealth, we're able to bring those providers anywhere. And the second that we bring that care to these rural hospitals, what's so interesting is how quickly and supportive the executive leadership of these hospitals is, because their local care model could rely on an aging provider base or one that's really overworked. And so providing through telehealth the resources really enables that hospital to deliver better care, but also deliver a better provider experience to their own workers.
That makes, yeah, that all makes sense. And but you mentioned specialists. So I mean, how would, something which requires, does require a, the patient to be in the same room as a clinician? Something I mean, I'm just like cardiology.
Sure.
How does, how is cardiology delivered, in a rural market?
Sure. And yeah, I would look at it more as, in the absence of specialist care, what happens to the patient, right? So in that case, if there are no cardiologists at a local critical access hospital,
Mm.
that patient obviously is going to bypass that hospital. So a cardiology consult still partners with the bedside care teams to provide that extra level of specialist interpretation, right? It quite honestly might mean that the patient still needs to be transferred, but without that cardiologist there, the patient's not even going to walk in the front door. Or be brought there from the ambulance. And so really the value that is specifically brought to the hospital is that care competency. We see in many of the critical access hospitals we serve that it's also just a great confidence builder for the local care team. Having critical care, cardiology, nephrology trained specialists available, they may otherwise not have been at that hospital to start with.
So let's shift over to the sales and marketing aspect
Sure.
of it. So when you're selling to a rural organization, a rural healthcare system, who are you selling to?
So, when we started our relationship with rural healthcare about 3 years ago, the first thing we realized, Adam, was um, this is a very tightly knit community. Rural hospital administrators from across the country know each other. They come together at specific events. For example, the National Rural Health Association annual conferences, and they share and communicate a lot about best practices. Um, the key to marketing, and I would say selling, as you asked, to rural hospitals is really understanding the local needs and challenges. And when I say that, many marketeers say, "Oh, well, that's just in your general marketing plan," but it's not taking a message that you use for an urban hospital and just simplifying it. It's really coming through and understanding what are the key challenges facing rural hospitals. This could be, as we see many rural hospitals facing financial constraints. There's a recent statistic that um, identified about 100 rural hospitals have closed in the past decade and a half, and nearly 600 more, which is about 30% of the total critical access market in the US, is at risk for closing in the next 5 years. So we see financial stability to be a big issue, but also making it local. And what we've found is we've talked to hospital administrators directly. It focuses on making sure that we resonate with the community. And that can be through, honestly, radio interviews, that can be through newspaper articles, and using digital media channels such as Facebook.
Got it. Yeah. Okay. So not that different. And what about the organization structures? So they're healthcare systems, right? I think when we were having a chat about doing this podcast together, you mentioned something about Sanford, which is North Dakota, or is it both Dakotas?
It's in the Dakotas. Yep. Amazing, actually. I was just reading it. A little plug for health leaders. They were interviewing the new CFO, Nick Olson. Quite remarkable organization Sanford is, because when you look at the sheer size of Sanford Health, they're covering 250,000 square miles. And in that vast expanse across South Dakota and the Dakotas, you have 48 medical centers, North Dakota, South Dakota, Minnesota. And across all of that vast area, they're trying to standardize care for rural access. That's just a remarkable feat. And really great article just to look at some of the insights of how to reach these patients. Now, the article does go on to showcase how the primary motivation is care delivery standardization, right? How do you actually make sure that a patient across the Sanford network, those 250,000 square miles, receives the same care wherever they go? Now, you spoke about the hierarchy in hospital structures. Critical access hospitals are led by a CEO. And, when I look at the CEO's relative relationship to their community, it could go back generations. And so really being a CEO of one of these rural hospitals it's a passion play. It's about something that they're dedicated and invested in.
Mm-hmm.
And through that, the conversations we have really emphasize what value they bring back to the community and the patients at large.
Yeah.
And if those patients aren't there, they see that the hospital isn't making the right decisions. And ultimately, if the hospital fails, the community fails.
Yeah.
And I heard and when we think about decision making and the gravity of decision making, great conversation and guide by one of my mentors in rural health. He said, Karsten, just think about it. A rural hospital CEO could be one bad decision away from the hospital closing. That's the magnitude of that decision level, decision-making authority.
Wow. So Stanford is, I don't think, maybe an unusual one, because it is one large healthcare system, 48, 48 hospitals.
Mm-hmm.
As you're selling into the rural health market, are there other large healthcare systems which are primarily rural? Are they, they're sort of buying groups? How do they cooperate to buy?
So that's a good question, and definitely part of our own learning. I think as a marketeer, you begin by thinking that there are 1,300 unique opportunities, right? And that doesn't scale well when you think that rural hospitals are, by definition, critical access 25 beds or less, right? So that's a lot of work going into probably a smaller return than many would expect. To that end, when I look at the 1,300 critical access hospitals on a bell curve, you're definitely going to identify those that have the progressive tendencies to want to invest in digital health because they have a burning platform. It could be that their current provider mix is aging out, retiring, or frankly, having been bought out and moving out of town, right? So there's that sense of urgency. What we try and do is start by building one core relationship with a critical access hospital. And then from that, in any specific region, the voice of the customer and the value of the outcomes of that partnership can expand to like hospitals. While many do operate as unaffiliated independent critical access hospitals, Adam, we are seeing that large systems sending their instances to the rural hospitals, thereby creating an affiliation.
You slightly broke up there. Can you just say that last bit again?
Sure. So to be clear, rural hospitals are unaffiliated, but there are rural hospitals that are now increasingly affiliated to, not part of larger systems, because obviously that's a lot of the transfer cases that larger health systems
Yeah,
receive.
that makes sense. Yeah,
I would say lastly, when you look at a rural hospital versus a large urban IDN, what they're lacking is purchasing power parity, right? The ability to, buy at scale. And so we are seeing in the market rural health partnerships and collaboratives being formed, which is quite interesting because these pull together the individual hospitals into a buyer collective. And through that, you really can start impacting rural hospitals at scale.
that's very interesting. Do they sort of operate like a GPO?
I would say they definitely are member-based organizations that do member-based contracting at scale. And the benefit there is, especially for telehealth, what we see is it's a model of shared services. Just from a labor standpoint, one rural hospital may not consume the entirety of a cardiologist, resource. And so by bringing those together, we can actually offer better pricing, but also better value for those hospitals.
Now, switch gears and talk about sort of tactical aspects of marketing. I mean, I remember when we were talking about doing this episode together, you mentioned something about how to reach these people, which surprised me.
Well, we reach them in a lot of different ways. I would say this is not a market where digital content is driving the biggest bang for the buck. In fact, I find that the best value for rural hospital access is getting personal. And you can do that through a wonderful network of federally funded telehealth resource centers, which are across the United States. They link up with states. Actually, the federal government sponsors rural health associations for every state. And so the critical access hospitals will be part of those entities, and they will offer opportunities to connect with companies offering goods and services in their space that are of value.
And they sort of like sort of small trade shows or sort of.
Yeah, absolutely. And you may only get 50 to 100 attendees, but realize those are the committed executives that have the buyer mindset and the decision-making authority. And you can, I wouldn't say the old days of making decisions on the trade floor, but really the key here is you're meeting exactly the right person who can learn about what your services are and decide what to do with it.
Yeah. I mean, it's just, you think you go to a big show like Becker's or Hims or, Vibe or whichever one, right? Trying to be equal in terms of mentioning all the usual suspects.
Yep.
And you may get tens of thousands of attendees across those. And, maybe speak to several hundred people over the course of those. But a lot of them are just going to be tire kickers, and a lot of them are not buyers. They're there for other reasons. Whereas you might go one of these events where there may be a 50 to 100 people. But to your point, everybody you meet with is there because they want to, not because they're checking a box to say I talk to these vendors to justify attending. It's I talk to them because I was interested in buying. They're much further along in their purchase process.
And you speak a lot on your podcast about buyer groups. I mean, we're talking here about a buyer, right? We're talking about an influencer who really,
Ah,
if you meet them there,
yeah.
remember their day job is running a hospital.
Hmm.
And so leaving that to go to a event like this, they're not only sitting at the welcome breakfast and at lunch, they're going to the seminars, they're learning, they're exchanging information, and they're really curious. Um, I've had just remarkable conversations across the rural events about what is telehealth. By the way, there's many that still range in knowledge, and so it's about thought leadership. Then there are others that are just so curious about where else to adopt it and apply it.
Yeah.
We've really run the entire, uh, you know, uh, continuum of knowledge of telehealth and acceptance of telehealth. But
Mm.
really, whether they're buyers or not, they're all influencers because in the rural market, it's about the relationships. And what we've found evidence is if your buyer today is not looking at your technology as a near-term buy, they could influence 5 or 6 rural hospital executives in the neighboring regions and be one of your biggest advocates. So um, this doesn't happen overnight. I've looked at it over the last 3 years as a student, and quite jokingly have moved from standing by the punch bowl to being on the dance floor, and the ability to have these conversations with these rural executives. They've seen the thought leadership that our company has generated
Mm.
specific to rural health. They've seen the outcomes, and they've heard from their peers. And for rural America, it's about hearing from their peers that what this new concept is that works. And once you have that, you are in a very, very good place.
Yeah. So actually, I what I took away from that was the point that peer-to-peer networking may be even more important in rural health than it is in other places. So just one
Absolutely.
little tactical thing I want to mention, because it's something you mentioned to me once, was that Facebook actually is a quite good way to reach these guys.
Yeah, actually, so as part of our research, we tried to identify where we could, engage with the hospital administrators and decision makers. And I would say classically, my first step was through digital channels like LinkedIn, professional networks.
Mm-hmm.
Um, we will undoubtedly come across the telehealth resource center staff and leadership. We will come across the state-based rural executive leaders on LinkedIn. We may not come across the hospital administrators on LinkedIn. And so for that reason, we did look in more deeply into Facebook and realized that truthfully, the population consuming the majority of the services of rural hospitals are the generation that's on Facebook. Many of the rural hospitals have
Yeah, it's the
significant
Oscar
followers.
thinking younger. Oh no, of course they're older.
Well, yeah, you said it, not me.
Yeah.
So, uh, we're getting to the point where we see that, and it's a wonderful culture. And you'll literally chronicle the participation of a rural hospital in their community from, Friday night flea markets to, the fireman's ball to, hey, we just started a new service. And in fact, one of our most recent hospitals that went live very purposefully co-developed ads with us to run on Facebook to reach that clientele. And again, is that selling more services? No, it's building brand credibility through your extended value.
I find that interesting because we use Facebook as a retargeting
Mhm.
tactic because it's quite good. It's sort of once you've driven somebody to your website, you've hit them on
Sure.
LinkedIn, you've hit them with programmatic, because then you get them retargeting. Because then it's like if they're on Facebook, it's like, oh yeah, I really do need to take action. But you're actually using it as a primary channel, which is unusual. That's very interesting. I hope you're not giving away your trade secrets there.
No, because I think at the end of the day, that the trade secret that I'd give away is, of course, critical access hospitals as a marketeer, they have less dedicated marketing resources than many of the larger hospitals. And so if we're able to support them with marketing to their patients, it's a triple win, right? We're winning for ourselves, we're winning for the hospital, and we're winning for the community. And so we actually do think that that's definitely the way to go.
So in addition to, you've got partners who provide the telehealth systems, partners like Caregility, which you know well, and then so in addition to providing the providers, you're also providing them with advice and services in how they actually market the new service line.
Yeah, actually, that's something I'll give a shout out. We started that initiative when I was still at Philips. I called it centralized marketing services, and at that time we offered it to very large systems. The key being, how could we, as specialized marketeers and pretty much a full body marketing shop, copywriting, digital media, etc. How can we partner with them to specifically extol the values and the value proposition of what they purchased? And for rural hospitals today, that really is key, because you may be looking at one or two marketing professionals that obviously have to do everything from the press releases to new patient information to okay, now we're implementing telehealth and I've got to learn everything about it, versus, hey, here's an organization that's actually going to partner with me, take that off of my plate, and deliver me complete professional solutions. We find that to be an excellent guide, and marketing to rural isn't just about selling. Marketing to rural is also about teaching, and we find that we're generating content to teach administrators on the wins and the outcomes, the saves. We're teaching rural providers about what is telehealth. It's not scary. It's something that can help you. And we're teaching the patients through different omni-channel capabilities to trust in it and recognize the value that their community hospitals bringing.
Karsten, this has been very interesting, and I've learned a lot, and I really like the fresh perspective on it's not it's not a market to avoid. It's a market to pursue if you have the right services for it, but you also approach it differently in how you sell a market to. So I'm so grateful to you for providing the level of detail of how you go about it. So thank you for that.
Adam, I appreciate it. I think the key to being a marketeer in rural is be personal and be genuine, because the key there is you're really bringing direct value.
Yeah, absolutely. Great. Well, with that, I think I'm going to wrap things up and thank Karsten again for his time today. And thank you to you for listening and for watching the video. So if you're listening and you want to see it, you can find it on YouTube. Just search Health Launchpad. You'll find the channel. And if you're listening to this for the first time, maybe you're hearing it on LinkedIn or possibly, then you can subscribe on Apple, Spotify, or any of the podcast applications. And as ever, I will be turning this into a how-to article, which you'll be able to find on healthlaunchpad.com. And if you like this and thought this was good, and you think somebody else in your network might find it useful, please share it. So, one thing I would ask as a favor, if you like this, is share this episode with 2 people. So with that, I will say thank you again to Karsten, and bid everybody farewell and see you on next week's episode.
Thanks, Adam.